Well, the clock is ticking for state employees. By Monday at midnight, all must be vaccinated for COVID-19. If you work in state-run health facilities, that's your only option. If you're not in that and you're just a regular state employee, you are able to agree to weekly testing as an option. Now, as of yesterday, the state said 8,000 state employees were not compliant. The state's sending out a directive to state agencies to prepare for staffing shortages. So joining us this afternoon to talk more about it, the governor's chief operating officer, Josh Geballe. Thanks for joining us this afternoon.
Hey, Jen.
All right, so 8,000 employees yesterday. Your office was confident that that number would continue to drop. What's the number in the count today?
Well, it's actually under 5,000 as of right now. So as we had hoped, the more and more employees are getting vaccinated, they're getting tested, they're logging their documentation in the system, and those numbers are coming down rapidly.
That is good news. So you directed state agencies to be prepared for these staffing shortages, even though it has gone down. 5,000 state employees is still a large number. And there are certain agencies, and a lot of the agencies, where it would be concerning to have those staffing shortages. The Department of Emergency and Public Protection, the Department of Health. And, we have our nursing home facilities. We have prisons that are of concern. This could be serious. So how is the state preparing?
Yeah, so we're working with all of our agencies today and straight through the weekend on contingency plans in the event that there are, meaningful numbers of employees who end up going out on unpaid leave next week. At this point, we remain optimistic, though, that, the trajectory is that most people are going to get their documentation in, and we're very hopeful that the disruption should be minor.
We know that obviously being optimistic is a good thing, but this is a reality that this could be happening in just a couple days here. I know you called in the Connecticut National Guard. What kind of capacity could we see our Guard members working in come Tuesday?
Well, it would really depend, whether there's a need in a specific agency or department. The National Guard has been an incredible resource throughout the pandemic. They've operated testing sites, they've conducted vaccinations, they've set up mobile field hospitals. They have, staff with civilian skills in any number of areas. So we'll see what the needs are as we get into next week, if any. We're hopeful that we don't have to activate them, but they're on standby if we do.
We have non-compliant employees by Tuesday morning, right, are going to be on unpaid leave, your office said, or between Tuesday and Thursday, I think it is. Is your office prepared to eventually terminate people? How long would they be on unpaid leave? What's that process, and what's your office looking at moving forward?
Well, we're still negotiating with our partners in labor about what ultimately would happen to someone who's out on unpaid leave for an extended period of time. So that's still work in progress. But look, even going out on unpaid leave for even a short period of time, though, it means you're not getting a paycheck. You become responsible for 100% of your healthcare costs. You're not accruing credit towards your time in service and your pension. So there's significant consequences even just of going out on unpaid leave. And we're really hopeful that few, if any, folks end up having to do that.
Do you think you'll give people more of a window on that unpaid leave before you possibly terminate someone?
Well, that's part of what we're negotiating. So we're going through that with labor and trying to find something that we both think is fair.
All right, Josh Geballe from the governor's office, thank you for the update today. And you just said just under 5,000 state employees as of today are non-compliant. That's down from 8,000 yesterday. Thank you.